More and more patients and fewer beds available. In 2 months, the chief of this hospital intensive care unit in Lyon has seen the situation worsen. In the region, more than 90% of the intensive care beds are now occupied, mostly by COVID-19 patients. This second wave is hitting harder than the first, and to avoid saturation, hospitals have no choice but to transfer patients, sometimes to the other side of the country.
We fear reaching a point when we'll be forced to choose patients based on their age or their health. Patient transfers are a solution to meet the increase in needs for ICU beds. It enables us to take care of new patients.
But these transfers remain hard on families. The patients are unconscious when the decision is made.
This makes the decision a little easier. Relatives are not allowed to visit anyway. But even if they don't visit in the hospital, they are used to talking to the same doctors on the phone. So it's still very destabilizing.
To avoid transfers, Anne-Claire is in charge of finding beds in other hospital departments that can be made available for intensive care units. But this mission has proved complicated.
It's stretched. During the first lockdown, which was strict, there were fewer patients coming for non-COVID emergencies. But this new lockdown isn't as strict, so there are still activities outside, there are still accidents, so it's very difficult to meet the demands both for COVID-19 and other patients.
Hospitals are also calling on personnel from other medical structures where there's less demand. Many of them have never or hardly ever worked in intensive care units before. This nurse used to work in the army, and training is being done quickly.
There is tension because we lack both personnel and beds. So now we're even more aware of the impact of bed closures. That's been going on for years before this pandemic. Training health professionals too quickly can have multiple consequences on nurses' psychological state, but also for the patients. They are supposed to receive an equal and high quality of care, but sometimes this is not the case.
The number of new cases keeps increasing here in the region, which means that the situation will get worse in a couple of weeks in hospitals. The region Auvergne-Rhône-Alpes is the most affected of the country, but it's too early to see the impact of the new measures implemented mid-October, and one question remains. Since the second lockdown is less strict than the first one, will it be able to slow down the number of patients entering hospital? In Lyon, Guillaume Petit for Euronews.
Health workers and other frontline workers are obviously delivering invaluable essential services, but as your report just showed, in very challenging circumstances and under constant pressure. So the kind of issues that can easily come up are accumulated stress, fatigue, burnout and exhaustion are some of the things we might expect as this second wave confronts us. I think the first thing I would say is that we all, whether we're managers or co-workers, family members, even just community members, we can all can and need to show the empathy and the respect, kindness, compassion, as well as appreciation of the work that the frontline and health workers and other frontline workers are